All right, good morning. We're here for our weekly Board of Commissioners meeting. It is Wednesday, September 22nd, 2001, 9 a.m. We're here in the Senator Hearing Room at 555 Court Street in Salem. And as legal counsel just reminded me, this is a really important day, first day of fall. So, as always, we will start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Chair, before we get started, I'd like to make a motion to remove action item number 5 from the agenda. The contract's not quite ready. That's the item to consider approval of architectural engineering contract with David Evans and Associates to provide engineering services for the Hazel Green Road Northeast Pudding River Bridge Replacement Project. This motion is to remove that from the agenda.
Okay, I'll second your motion. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Okay, that action item is removed. So we'll go into public comment. David Beam is here. David, welcome.
County Commission.
Oh, well, no, that's okay, because that one's all set up for your flu shot.
Oh, sorry.
My flu shot. Welcome,
Yours.
David. Yeah.
I brought an extra.
My name's David Beam. I'm a spokesman for disability people, and I want to get a TP thing for the blind and the deaf, the ones that need emergency funding for that program, because we don't have any funding for the disabilities persons or blind and are deaf, don't have any way to get somewhere in emergency. So I think we need to have a backup system for the county with funding for that for the next year. That's all I am asking for the police department, the county one, and the state will fund that program for the county.
Thank you, David.
Thank
Yeah.
you.
Good to see you,
Thank you.
as always.
Nice. It's nice seeing you again too.
I got your message upstairs that you were going to be here today, so
Yes, I did.
appreciate the warning.
I
Yeah,
said good morning,
the heads
too.
up. Yeah,
Okay.
yeah. See you
Thank
soon.
you.
Thank you.
Okay, is Chad here? Is he doing who's doing the COVID-19? Oh, he's hiding in the corner. David, good to see you, thanks. Chad's going to give us a presentation update on COVID-19. Welcome.
Welcome. Thank you. Good morning, Chair Cameron, Commissioner Willis. For the record, Chad Ball with the board's office. So I'll be doing the COVID update for this week. So during the previous 2-week period, which was 9/5 through 9/18, COVID case rates decreased in Marion County by almost 2%, and the state by 6.5% compared to the previous 2 weeks. As of today, we're averaging around 228 cases per day in Marion County, and we expect to see that decline over the next 2 to 3 months. As of 9/21, we have 70% of adults in Marion County, 18 and older, are vaccinated with at least 1 dose of the vaccine. And about 57.5% of all eligible people of ages in Marion County have received 1 dose of the vaccine. We continue to see a growth in Marion County vaccination rates. We're seeing about 2,000 people per week getting the vaccine, which has been really great. Pfizer has stated that their trials in 5 to 11-year-olds produced a strong immune response, so Pfizer expects to submit their data to the FDA by the end of the month, and kids could start receiving the first dose by Halloween. It's going to be a lesser dose, still going to be a 2-dose shot, but that will be coming. Last Friday, the FDA recommended that people 65 and older and those considered at high risk of severe COVID cases receive a booster dose of the Pfizer vaccine if they have previously been fully vaccinated. The recommendation will go to the CDC's Advisory Council and the Western States Sports Group on September 24th. Once the Western States issues a recommendation, OHA will support implementation, and then it'll be here in Marion County as well. Booster doses are different than the 3rd dose. In August, the FDA adjusted the emergency use authorization for the Pfizer and Moderna vaccine to allow immunocompromised people to receive a 3rd dose of either vaccine. No booster has been recommended for J&J at this time. As kids head back to school, it's important to remember those important safety measures. Wash your hands frequently, wear a mask or a face covering, maintain social distancing from those not in your household, and stay home if you're sick. And as always, talk to your medical provider and see if the vaccine is right for you. One positive note, kids are not getting severe disease from COVID-19, and we're also beginning to see a plateau in cases of kids, which now that they're going back to school, we thought we might see an uptick, but it's plateauing and starting to see a little bit of a downward movement. So that's it for me, unless you have questions.
Questions?
Not right now.
We had a little spike this morning from yesterday morning, it looked like, but
We did, that's what it looked like, yeah.
a little more. It'd be great to see that continue to go down every day, but the trend is more important.
Yes, the
not
trend is
just one
going
day.
down.
Yeah,
And I know we looked at OHSU data yesterday that showed that, we're starting our gradual downward trend now, and hopefully that continues.
great. Thank you.
All right, thank you.
Okay, so the next thing is get your flu shot today, I believe. And Don is here to give a little presentation. Then while you're doing that, I think I'll see if I can get down to my long sleeve shirt off. I don't own a short sleeve shirt.
You're
Dress
gonna
shirt.
get into
I
your
think you-
Christmas present.
I think you just like taking your shirt
No,
off
I
on
don't
camera.
wear short sleeve shirts. I just like to take my shirt off. Is that what you said?
I think you like taking your shirt off on camera.
I'm gonna do it over here off camera.
I think it's his hero outfit, actually. So, once again, it's that time of year for another intriguing episode of Flu Shot Hero. Our episode today is Flu, the familiar winter nemesis. Last episode, we saw our flu shot hero, Commissioner Cameron, bravely receiving his flu shot for all the world to see. Let's find out what our flu shot hero has been up to. Why, this past year, he helped our Marion County community brave COVID-19, wildfires, ice storms, and extreme heat, all while having the superpower protection of a flu shot. Again, we ask, why and how does he do it? Why indeed? Because he knows that skipping the flu shot could be riskier this year with COVID in our midst. Dr. Bernard Camus, infection disease physician, says you could get COVID-19 and a flu infection together. This is risky because your immune system could be overwhelmed by two viruses at the same time. Getting sick with the flu could mean trying to find space in hospitals, which might already have limited capacity. Getting back-to-back infections could result in more serious illness, since the first infection might have already weakened your lungs, according to Dr. Pyra Nori, infectious disease specialist. The flu can cause secondary infections like pneumonia, sinus and ear infections, inflammation, or worsening of asthma, chronic heart and lung disease. The flu vaccine has been around since the 1940s, and contrary to popular belief, it won't give you the flu. But it can keep you from becoming really sick. Commissioner Cameron certainly does his part to stay strong and healthy for our community and helps protect the people around him. How, you ask? Can you be a flu shot hero like Commissioner Cameron? Anyone over 6 months of age can get a flu shot. It's especially recommended for pregnant women, those who are around children and newborns, those who are immunocompromised, travelers, children, people over 65 years old, and caregivers. Almost everyone can and should get a flu shot to help protect others. Flu shots are readily available at most pharmacies and through your doctor's office. It takes about 2 weeks to have the full effect of a vaccine. So get it in advance of your holiday gatherings. And if you haven't gotten around to getting your COVID vaccine yet, it's safe to get both the flu and the COVID vaccine at the same time. You know what to do. So get out there and protect your family, your community, and yourself by getting a flu shot. Save yourself and those in your community from a potentially lethal illness. Help keep yourself and others out of the hospital, emergency room, and urgent care. Now is a perfect time. Don't let your defenses be caught off guard this year. Contact your provider to make an appointment. Others may not know about your heroic effort, but deep down, you will know you did the right thing. You hero, you.
So you want me here?
Yes, yes. Do you have a preference, which arm?
Left, please.
All right.
So is that way I can reach out to the other commissioner on my other side? So I will say this in all seriousness that, you know, I do this every year just because I want to encourage other people that it's okay to do it. I'm not a hero. I just want to be a normal person and set the example for others. And I understand that some people may need to, you know, seek their doctor for not only this, but for COVID vaccine. COVID vaccine did that on April 7th while sitting in the same place. And I visited Salem Health, the ICU unit, a week ago, and it wasn't pretty. And to hear the nurses there talk about people who were dying and didn't have their vaccine, and people who were going to go home that did have their vaccine, that we know they work. And on the flu shot, I will say this. I remember years ago, this was way before I was a commissioner, I went to see my doctor because I was sick. I wasn't feeling good, and he says, well, you've got the flu. And I said, well, I had the flu vaccine. And he goes, well, if you had not had the flu vaccine, you would have been even worse. So it doesn't prevent it necessarily, but it does reduce the length of the time and the symptoms that you may have. So that's just my personal testimony. I wanted to share that. So have at it.
Awesome. Thank you for being a hero today, too.
Oh, yeah.
All right, 1, 2, 3, and poke.
We ready to do it?
See nothing to it, right?
Right. Thank you.
Thank you.
Thanks for all you do in our health department, and it's been a rough 2 years, and we're going to get through this all together. And thank you to the public for wearing a mask and protecting yourself and others and getting vaccinated. Thanks.
Put your clothes back on.
I'll be right back. Go to the uniform closet. Wait, I'll just do the rest of the board session
Yeah, there you go.
without a tie. Okay, our next item is Wildfire housing proposal. And Matt Lawyer from the board's office is here, and Matt's going to come up to present. And I do want to say this as Matt presents. Jan Fritz, thank you for your efforts. Commissioner Bethel, Brian, Nicholas, and Matt, thank you for driving this thing, coordinating and keeping it going. And there's been a lot of people that are working on this, but this is a good presentation. We saw this, I think, last week as a board, and we thought, let's make sure that we do this publicly to show people what we've been working on for wildfire recovery in the housing. So Matt, welcome.
Thank you, Chair Cameron, Commissioner Willis. For the record, Matt Lawyer, Policy Analyst for the Board's Office. Very excited to be here today to talk about a short and long-term housing plan that we are in the process of developing to return survivors of the 2020 Labor Day wildfires back into their communities. Currently, we have a hotel that is hosting 11 adults, 4 children, and 9 rooms. In Mill City, there's a temporary RV location where 14 adults, 6 children are occupying 12 RVs. According to data received by the Sustanium Service Integration Team, or SIT, as of July 8th, there are more than 300 households who are renters that are at locations other than addresses such as hotels, friends' houses, or family houses. Our housing goal is to create a short-term housing process of 2 to 3 years with some options to extend. Along that lines, we're also creating a long-term housing option that will accommodate a variety of housing needs, including needs for renters and buyers, with an emphasis on workforce housing, and create a variety of different housing types such as apartments, townhomes, duplexes, and single-family residential areas. We're going to move those individuals, hopefully, from the short-term housing into these long-term housing options as the plan is being developed, and work with various partners to ensure their success. One of our first locations is at North Santiam State Park. This is up Highway 22, just off to the right as you're heading out towards the east. We're calling this the Santiam Cabins. So as you're looking at this image here, this is a drone shot from the parking lot, and you can see in kind of the foreground to the right is the camp host area, and then up to the top of the picture is the river. And so kind of in that area right near where it says Santiam State Park, we're looking at possibly putting some cabins in that area. The cabins are 16 by 24 foot cabins, similar to what you'll see in most of the state parks that have these cabins. The cabins are constructed by Oregon Correctional Enterprises. The cabins will have a master bedroom as well as a bathroom in the unit. And then in the sort of open space, there will be opportunities to look at different accommodations for different sleeping arrangements for folks. The goal here is to create 16 units that'll hold 16 households at the North Santiam State Park. As I mentioned, the units will be built by Oregon Corrections Enterprises. When the units come online, they'll be owned by the Marion County Housing Authority, who will own and operate the temporary housing project for the short-term basis. Once the short-term housing project is complete, the ownership would transfer potentially to the Marion County Parks and be used as something within the park system. So the cost for this, land improvements is about $827,000, and the cost for the cabins on the high end is $1.2 million for all 16 units. We're working with Oregon Corrections Enterprises and an engineer to bring those costs down, and maybe going out to the long-term recovery group to ask for some additional options to help reduce the cost of these units. With the contingency, the total cost for this area is $2.2 million. Our second site is in the city of Gates, at the Gates Motel property. This will be a tiny home village. As you can see here on the map, the tiny home village is located at the former Gates Motel property. There will be a one-way road that'll enter off of Central Street in Gates. Each of the units will be paved to include 2 parking spots for the tiny homes. The existing shop will remain in place as it was not damaged during the fire, and we'll develop a septic field at this location that'll be located in the northeast corner of the property. So this is an example of what a tiny home may look like. This is a loft model, and the loft model will be designed with a master bedroom, a bathroom in the unit, and then also a space to include a stackable washer and dryer. The loft itself could be turned into additional sleeping quarters or be used for storage or whatever the household needs to use that space for. Each of these units is on a chassis, so they're able to be moved at times if necessary, but for purposes of the temporary housing program, they won't be moved. So this will be 16 units as well. Again, the Marion County Housing Authority will own and operate these homes and then transfer ownership over to the county once the temporary use is complete. And then Marion County may use them for vacation rentals at some of our parks after the temporary housing program is complete. The land improvements here is $889,000. The cost for the tiny homes on the high end is $1.1 million. And a contingency of $193,000. So comparatively to North Santiam, it's about the same dollar amount, a little over $2.2 million for each location. So our phase one, which is our short-term housing project, Oregon Housing and Community Services has committed to providing a letter of intent to award the grant funding. The land improvement cost for both locations is, as I said, a little over $2 million just for the land improvements. And then wildfire funding from the 2021 state legislative session will pay for the cabins and the tiny homes as well as the installation. Our long-term housing program, right now we are actively engaged in developing the proposal for the long-term housing. As I mentioned earlier, we want to provide a variety of possible housing options, including, as mentioned, the apartments, townhomes, duplexes, and single-family residential. The emphasis will be creating the housing that is affordable for wildfire survivors and the workforce within those communities. And we're going to continue to work with state agencies in partnership to ensure the projects are viable, cost-effective, and meet the needs of the survivors. So for the land development, in terms of getting these sites site-ready to put the units on, we got approval from the state to move forward on the process on September 10th. And it's going to take approximately 17 weeks after the project kickoff meeting to get those sites complete and ready to accept units. So optimistically speaking, we're talking the first part of next year, January, February timeframe. And I think it's important to call out all those individuals that help us get here, specifically the 2021 Legislature and Wildfire Committee, the Mid-Valley Regional Solutions. Jody was just absolutely incredible through this whole process. Oregon Housing and Community Services and their consultants, Bruce Wood and Tom Kemper. Oregon Department of Environmental Quality, Mary Camarada and her team came on board and were very, very helpful in telling us all the things we needed to do to get to yes, or at least move towards yes, especially with the septic. Oregon Parks and Recreation Department, Lisa Sumption and her team and all the folks at North San Am were incredible. Oregon Department of Transportation has been very critical in this conversation and worked directly with Brian Nicholas with Public Works to make sure this moved forward. DLCD has been at the table as well. And then I just want to give a real big shout out to Michael Kaiser and Darla over at Oregon Corrections Enterprises for answering all the very strange questions that have come forward and the what ifs. They've been incredible. So our other partners, obviously the City of Gates, we had a great meeting yesterday with their team. Mill City, our absolutely fantastic San Am service integration team for helping us get the data for the individuals. And then really they're going to be our partners holding our hand, kind of bringing us through the process to identify the survivors and make sure we're getting the right people into those units and making sure that they're comfortable and have a plan to get home. The Mid-Willamette Valley Council of Governments, they were instrumental in helping create the necessary zoning changes in Gates to bring that forward. And then of course, everybody within the board's office, Public Works, Brian, Nicholas, Brandon Reich, Chris Trussell, I'm gonna forget some folks, but just absolutely, Ryan Cruther did the amazing site plan for Gates. Just the most amazing group of people, Kim bringing her expertise with septic. It's just been real great to work with those folks. Our assessors for helping us get some of the additional data, business services, and then our community service department. So it's been a massive collaboration. There's other folks on this that have helped us along the way, and just really appreciate that and getting us to a point where, you know, we have a success story and we're ready to move forward with something great.
So, Matt, thank you. I know yesterday we gave this presentation, you and Jan, and I was on there with the City of Gates, with the mayor and their clerk, and I think Marion Hills was there, who's been helping them, and they were really, really thankful and appreciative of what, you know, having that presentation of what's going to happen there. I know it's taken a lot of work, and we haven't even, well, I shouldn't say this. We have turned to shovel. I know you had a group of volunteers that went up. You want to share about a little bit about what happened there?
Yeah, thank you, Chair
That's
Cameron.
a really interesting one.
On September 11th, we had a group of 200 folks from the Church of Jesus Christ of Latter-day Saints, the various locations throughout Salem and Kaiser. that came forward and asked for a volunteer project. And with North Sandiam State Park being one of the locations we're looking at and having it being hit fairly significantly from both the wildfire and the ice storm, we thought, what a great place to go. And so we mobilized about 200 volunteers to go out there for about a 4.5, 5 hour period. They brought everybody. I mean, we had folks with heavy equipment out there helping move, get rid of the old broken paths and the asphalt paths in the area, got all the campsites cleared, got all of the debris for the most part, especially in the area closest to the river, all stacked along the trails. The paths were refilled with aggregate, and then like they actually brought a roller, which was super cool. I kind of wanted to drive it, but had the safety vest on, so I couldn't. But they got that all rolled out, and so they got really nice paths down there. The funny thing is we were working with the state partners on that. They kind of thought, oh, it'd be nice to paint a couple signs, which they did, redo some picnic benches, which they did, put some new information kiosks, which they did. And the coordinator for the church said, okay, so tell us what your dream sheet is. And they said, oh, well, here it is. And they accomplished more than 90% of the goal, which was really incredible. And so, I think that is just in the spirit of what we've seen throughout the duration of the fire is people helping people, strangers helping strangers, and neighbors and communities coming together to really just make the transition back to normal in that area successful. And so we were very thankful to have those folks out there, and Tom Kissinger was incredible to help coordinate that with the state parks. And it was a great day. I mean, 9/11, 20-year anniversary, you couldn't ask for a more humbling experience to spend the 20th anniversary than in the service of our community. So it was really great.
We should put a thank you up there for community partners too that are helping us with those types of things, because that when you told that story the other day, I just went, oh wow, many hands make light work, and to hear that they got that much done in one day, where our expectations or the park's expectations was just a few things here and there, and they just took the dream sheet.
Right.
Yeah, good. Commissioner?
Well, I think it's just indicative of the way this community's been all the way through, folks from all over coming together to help the canyon rebuild, and it's great to see this finally come together and find some housing for folks that unfortunately are still fighting their way back, Last week we celebrated that over 50% of the homes that burned now have septic permits and are on their way to rebuilding. But what I didn't say, and I should have, that still means there's about half of our folks that are still fighting to get back home. And we're absolutely committed to walking with them and working with them and trying to do everything we can until every single one of our folks in the canyon is back home. So thank you for your work doing this, Matt, because I know it looks like a simple presentation, but it's been hours and hours and hours of work behind that PowerPoint. So thank you for what you did.
Absolutely.
I want to add a couple things. We did the fundraiser at the state fair. We got a report yesterday. What did we have from Tamara? We had seven contributions, but with United Way we have about 30, we figured 37,000 or 34,000 that has been contributed towards some of the gaps for some of these things. That I want to thank people for doing that. We made a decision to keep that up on our website until the end of the year, so encourage people, they can still donate to that, and it goes through the United Way to help these victims. That's there. I want to share. I'm back in my house up there, but last night I realized my schedule. This is just weird stuff of somebody who didn't even lose their house. But in the past, I would have had neighbors up there that I could call and say, hey, can you do this for me? Because I've got a delivery coming that needs to be signed for, and I've got to be down here. And I sat there last night and I go, I don't have anybody. There's nobody around up there to go have dinner with or say, hey, are you going to be in town that you could do this for me? And so even the people that are getting back, I mean, there's a community that we're all working together, but it's different. than it was before. When you take, and I always think of Detroit people that used to ask me what I like about it, especially in the winter, and I said nothing, because there's nobody there, but now there really isn't anybody. We had a planning commission meeting last night, and I know a couple people that live up there, but it's gonna take a while for the new relationships to really impact people's lives in a direct way that are coming back. So this is a great step towards the temporary housing and just even all those other things that we don't even think about. We assume once you have shelter over your head, you go, okay, things are okay, but it's weird. It's different. So, Matt, thank you. We were supposed to give this tomorrow to the Wildfire Committee in the legislature, but we know they've got other things they're focused on over there, or not focused. Huh? So it got canceled, I believe. But we'll hopefully get this in front of them and show all the good work that's being done.
Well, and Commissioner Cameron, we also have to thank Commissioner Bethel, who's not here today, because she's also been driving this train.
Oh, my gosh.
And she's out, health-related reasons, and hopefully she's back with us soon. But her absence is certainly not due to her not working on this. If anything, she's been spearheading the whole operation. So
Yep.
it's important that we thank her as well.
And there is a visioning session tomorrow night at Gates, Thursday night. I think it's from 5 to 7 or 4.
6 to 8 Thursday, and then 5 to 7 Friday.
In Detroit on Friday, yep. So encourage people who want to show up for that. Okay, anything else?
Great job.
Thanks, Matt.
Thank you,
Appreciate it. And Commissioner Bethel, hopefully you're watching. Thank you for all your hard work on this. We really, really appreciate it. All right, our first and next agenda item is a proclamation considering approval recognizing the month of September as National Recovery Month in Marion County. Terry and Melissa are here. It's good to see you. I haven't seen you since I toured your facility
I
seems
know.
like maybe it was a year ago. I don't know.
It may have been. Good
Yeah.
morning.
Good morning.
Good to see you all today. I'm really excited to be here today. I'm Terry Morgan. I'm the program supervisor for Marion County Health and Human Services Addictions Treatment Program.
Hello, I'm Melissa Pola. I am the counselor at Her Place, which is structured day treatment for pregnant and parenting women with substance use disorders.
Welcome.
So this is a very exciting month for us. September is National Recovery Month, which is now in its 32nd year. It's a month-long celebration for those in recovery. So this month, we cheer for those who overcome or successfully manage conditions of substance use disorders. And we celebrate the wider recovery community, including 12-step community, religious organizations, community partners that come alongside and help support those experiencing addiction and helping that, coming alongside them on their road to recovery. In addition to the celebration aspect, the observance of Recovery Month extends to supporting several aims. One is to increase awareness and education and reduce stigma and promote the best services that we can provide for our community struggling with addiction. A further aim is to emphasize addiction often coincides with mental health disorders like depression, anxiety, post-traumatic stress disorder. Therefore, we recognize the co-occurring disorders that people experience and overcome. This year, Recovery Month centers on the theme, recovery is for everyone, every person, every family, every community, and highlighting the experience of addiction and recovery for inclusion and diversity in our recognition of the sweep of substance use disorders. Addiction is a disease of isolation, and there's been many challenges presented due to the pandemic. Addiction is epidemic in our country. Therefore, we're working to help treat an epidemic during a pandemic, during wildfires, during the ice storms. During that time, since the onset of the pandemic in March of 2019, we have enrolled 1,076 individuals into our addictions treatment service programs to help them begin their recovery journey. We celebrate the lived experience of our staff who so willingly share that and encourage our participants. And we don't want to forget our significant amount of unsheltered persons that show up every day for treatment. We continue to strive to develop and promote low barrier access for persons in our community. And we celebrate all our community partners that promote recovery. So for every person, every family, and every community, we celebrate recovery this month. And the best part now is I want to turn this over to Melissa Pola, who's going to share with you.
Thank you. Melissa, welcome.
Yep.
It's my pleasure to be
Melissa,
here.
move the microphone.
On November 23rd, 2011, I turned my life over to the hands of God and to the staff at Her Place. My children were all in custody of DHS, and my addiction had resulted in the removal of my newborn. Scared and alone, Her Place showed me how to pick myself up and to learn how to develop a lifestyle of recovery from the addiction and the trauma that consumed my life. With hard work and support, I was able to get custody of my newborn and visits with my older children. With ongoing encouragement and recovery support, I gained the skills to parent my children who are all thriving, and today we are a strong, resilient, recovering family. Over the years, I have used the skills that Her Place and the recovery community taught me. I completed the Addiction Studies program at Chemeketa Community College and became a certified alcohol and drug counselor. And almost 4 years ago, I applied for and was offered my dream job. I am the primary counselor at Her Place, and I'm able to give back to the women that enter Her Place scared and alone, and to help them gain the skills to begin their recovery journey. In November of this year, I will celebrate 10 years of recovery from addiction and trauma. With recovery support, I became a healthy, capable, and self-supporting mother, woman, homeowner, and community member. I am certified in drug and alcohol counselor. I have my license as a 2. I hold a bachelor's degree from Corbin University, and I am proud to share that I am in my 2nd year of my master's program at Portland State University, working towards my master's in social work, and I'm beyond honored to have been given the opportunity to give back to my community. Recovery fosters hope and has taught me to never give up, that my dreams are attainable if I work for them, and to always, always reach for the stars. Recovery is for every person, every family, and every community. Thank you for letting me share my story.
Thank you, Melissa.
Can we applaud? Wow.
Mr. Chair, if I may, I just want to
Go
say
ahead.
thank you.
Yeah.
Because I think one of the things that Terry, I love about your program, I love about the folks that work in addictions at Marion County, is it's a huge accomplishment what you've achieved. But you could have said, okay, I've accomplished this, I'm going to go take care of my family and myself and do my thing. And I think the thing that just makes me so proud of Marion County Health Human Services and the addictions work is you're giving back. You're not just taking the skills you've learned and the talents you have and using them for yourself. You're saying, no, I'm going to go help the next gal. I'm going to go help those next kids, that next family. And I just, it's a sign of a healthy organization when the people you serve end up serving you afterwards, right? It's really a wonderful thing. And so I want to say thank you for sticking with us and being willing to give back to the other folks in our community. I really appreciate that.
Thank you, it's an honor.
Yeah, I what a great testimony, and I love the first sentence. This is Recovery Month. Well, it's Recovery Day every day, right? I mean, we all have to continue to just focus on what's truly important in our lives, and it gives us that hope to keep moving forward. So, I'm ready to. I'm ready to celebrate this proclamation. So let's get a motion and get going here.
All right. But before we do, Terry, are you running this show now?
Well, I'm currently working at a classes program supervisor.
Oh, good. I'm sure you're doing a great job.
Thank you.
Okay. Sorry, Mr. Chair. I move, what's my motion here? I move that we approve a proclamation recognizing the month of September as National Recovery Month in Marion County.
I'll second the motion. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. All right. You want to go ahead and read the proclamation?
Sure thing. In the matter of proclaiming the month of September 2021 as Recovery Month in Marion County, a proclamation. This matter came before the Marion County Board of Commissioners at its regularly scheduled public meeting on September 22nd, 2021. Whereas recovery from mental health and substance use disorders of Marion County residents are of the utmost importance to the well-being of Marion County as a whole. And whereas all Marion County residents have faced challenges in the past 18 months that may have impacted their wellness, including a global pandemic, civil unrest, wildfires, an ice storm, and other difficult and tragic circumstances. And whereas the impact of mental health and substance use disorders is apparent in our local community, as there were 228 drug-related deaths in Marion County from 2016 to 2018, and at least 339 drug overdose deaths in Oregon from January to June 2020. And whereas the stigma associated with substance use and mental health discourages individuals from seeking timely, appropriate, and life-changing help, and whereas managing the effects of these conditions helps individuals achieve healthy lifestyles, both physically and emotionally. And
whereas with commitment and support, those impacted by substance abuse and mental health disorders in Marion County can embark on a journey of improved health and overall wellness. And whereas through Recovery Month, our community can become more aware and able to recognize the signs of mental health and substance use disorders, and individuals in need of recovery services are encouraged to seek help. And whereas Marion County Health and Human Services and our community partners are committed to promoting environments that acknowledge and support the relationship between substance use and mental health disorder recovery and overall health and wellness. And whereas the focus of Recovery Month this September is to celebrate all people that make the journey of recovery possible by embracing the 2021 theme, Recovery is for everyone, every person, every family, every community. Recovery Month spreads the message that people can and do recover every day. And whereas the September National Recovery Month observance continues to work to improve the lives of those affected by mental health and substance use disorders by raising awareness and educating communities about the effective services that are available. For the above reasons, we are asking the citizens of Marion County to join us in celebrating this September as Recovery Month. Now, therefore, it is hereby proclaimed that the month of September 2021 is Recovery Month in Marion County, dated at Salem, Oregon, this 22nd day of September 2021. Thank you.
Thank you.
Congratulations. We're going to have a copy for you.
you know, Terry, I really like the theme for this year, that recovery is for everyone. I think we're learning more even about, you know, addiction to electronics and that sort of thing, and unhealthy behaviors and habits, and realize how important that is, that it's an ethic, really, that we help each other, you know,
Absolutely.
out of our addictions, and to be healthier and to support each other. I like that, because I really do believe it's universal. And
Thank you so much. It is very important, and we are very committed and passionate about serving our community. Addiction and treatment truly is about saving lives.
yeah, absolutely. Yeah. I know I have family members who struggle with substance abuse and addiction, and so it hits close to home. And it's one of those things that it's a lifelong, really, commitment to support those folks, you know. And whenever you lose somebody, it really hurts, you know, because those are people that you love and you care about. And so I'm just very grateful that we have people here in Marion County who are willing to really dedicate themselves to folks who are struggling with substance abuse, especially because not all days are good days, you know. Mm-hmm. And sometimes it's like you have to get back and go to work again tomorrow, even though yesterday was a really hard day, you know. So I just want to say thank you. I really sincerely appreciate the work that you guys do.
Thank you for the
Thank you.
opportunity.
Thank you. Well, the next item we're coming up on is our consent calendar.
Okay, Mr.
I think
Chair.
it's your turn.
I think it's always my turn today. I move that we approve the consent agenda. In it, under Business Services, approve an order for the resolution of a litigation matter. Under Human Services, approve a recommendation to reactivate the Labor and Employee Relations Manager classification and uphold the pay grade for classification code 064 Human Resources Manager. Under Public Works, receive a notice of hearing its officer decision recommending approval for zone change comprehensive plan amendment ZCCP case number 21-004. Anthony Arnatov, and schedule a public hearing for October 13th, 2021. Under Sheriff's Office, approve amendment number 5 to the intergovernmental agreement with the Bureau of Land Management, BLM, to add $101,952 in incoming federal funds for a new contract total of $166,788.72 to continue providing patrol services on BLM land through September 30th, 2022. And under Tax Office, approve an order for the cancellation of uncollectible personal property tax accounts in the amount of $119,949.01.
I'll second the motion. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Okay, first item under action, Health and Human Services, consider approval of a contract for services with locumtennis.com in the amount of $760,000 to provide qualified candidates to fill temporary medical staff positions in behavioral health programs and alcohol and drug treatment programs through September 30th, 2024. And Sydney, welcome.
Hi, good morning, Commissioners. Sydney Nestor, Behavioral Health Division Director for Marion County Health and Human Services. This locum tenens contract, it helps us provide short-term temporary prescriber services in our adult outpatient program, our children's outpatient program primarily is where we use those. So our goal is always to contract with long-term prescribers for those programs, but that isn't always possible. And that's when we really rely on this contract with locum tenens. And so they essentially find the prescribers for us, psychiatric nurse practitioners, and psychiatrists. And so we hold the contract with locum tenens, and then they support the prescriber. Sometimes those are prescribers that provide only telehealth, though typically locum tenens has been able to help support us to find prescribers who will work on-site in our buildings. Currently, right now, we've got one locum tenens prescriber working as the psychiatric nurse practitioner for our ACT team, which is a really critical position. The work that the prescribers do is not something that we can just go without when we don't have contracted providers in place. So having this contract has been really important for us to maintain consistency and stability with our prescriber services.
Sydney, just how long have we had this particular vendor?
You know, I sat in my chair and I thought someone's going to ask me how long we've had this contract. At least
It's
5
been-
or 6 years. Do you know, Ryan?
Yeah, I was gonna say, it's been a while.
Yeah.
Right, okay.
Sydney, and I apologize, this is gonna sound like a silly question, but what sort of medicines do they prescribe? What's
Oh, sure. I mean, these are all psychotropic medications that they prescribe. So, so medications used to treat psychiatric disorders. So those could be antidepressants, antipsychotics, things to assist with anxiety in children, potentially things to treat attention deficit disorder, those are some of in our adult programs, we're typically serving people with really significant psychiatric diagnoses, like bipolar disorder and a variety of psychotic disorders. In our youth programs, typically it's more the disorders that impact children are more likely to be, again, maybe attention deficit hyperactivity disorder, anxiety, depression, those types of things.
Okay, thank you.
Okay,
I don't have any other questions, Mr. Chair.
good. I'll take a motion.
Mr. Chair, I move that we approve the contract for services with locumtenens.com in the amount of $760,000 to provide qualified candidates to fill temporary medical staff positions in behavioral health programs and alcohol and drug treatment programs through September 30th, 2024.
All right, I'll second the motion. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Thank you.
Great, thank you very much.
All right, good to see you.
Good to see you too.
Okay, next item. Consider approval of contract for service with Garden Services in the amount of $800,000 to provide janitorial services at various county locations through September 30th, 2024. Ryan, welcome.
Good morning, Commissioners. Ryan Matthews, Administrator with the Marion County Health and Human Services Department, and I am here seeking approval of an $800,000 contract for services with Garden Services, and they provide janitorial services to our leased properties. So we have our county facilities team, which helps support with janitorial services and custodial services in our county-owned buildings, but for our offices in Silverton Road, the Beverly Avenue buildings, Woodburn, the Psychiatric Crisis Center, and our cottages, we contract those services out to a janitorial contract. And we have we recently went through the RFP process. Well, actually, we went through a procurement process and have selected Garden Services, who is a QRF, which is a Qualified Rehabilitation Facility. And we've selected them to provide our janitorial services at those county leased properties. This contract would include daily services such as cleaning of floors, sweeping, mopping, cleaning counters, sinks and toilets, emptying garbage. And then we have in the contract some specialized services that would happen sort of periodically, which would be things like deep cleaning of carpets, stripping floors, waxing, some of those that you might do a few times a year. And so we're really looking forward to this. We had a contract with a previous provider that did not quite meet our needs, so we've selected Garden as a new provider, and we're really excited to get them in there and allow them to do some good work for us. So does anybody have any questions related to this?
I don't.
No?
Yep.
Okay.
Garden's local
They are, yes.
company too. It's good to see that they got that contract, and
Yeah.
they do really good things in our community, so,
Yeah, we're excited to be working with them.
yep. All right.
Good. Okay, Mr. Chair, move that we approve the contract for services with Garden Services Incorporated in the amount of $800,000 to provide janitorial services at various county locations through September 30th, 2024.
I'll second the motion. Any further discussion?
Ryan, can you stay for just a minute after the vote?
Sure.
Okay.
Yeah.
Any further discussion?
Nope.
Nope, okay. All those in favor signify by saying aye.
Aye.
Okay, aye.
You gotta vote aye too. All right.
Yep. Next.
Before Ryan goes, I just want to ask a question. Ryan, and I apologize, I should have asked this before. The temporary medical staff positions for behavioral health and alcohol and drug treatment, is that folks that are, because we talked about psychotropic medications.
Yeah.
Would that be for people with co-occurring disorders, or are they also doing drug and alcohol prescription?
I mean, I think locum tenens could do providers that can provide alcohol and drug services. We haven't utilized them for that. I think this was just written more broadly that if something was to happen, like for example, we were to lose our contracted medical doctor that's associated with our MAT program, for example, and we needed somebody temporary to fill in, at least within the scope of work that's built into this contract, so we could tap into that.
Okay.
But it's not something that we're actively utilizing at this point.
Okay, thank you.
Great, thank you.
All right. Thanks, Ryan. Yes.
I'm sorry, I lost track. Did you take a vote?
Yes.
We did take a vote.
Yeah, because
I
he
had to remind the
he had
chair
to
to vote.
remind me, and I said, okay, aye.
Okay.
There was only one vote.
If
We
you
were
roll
waiting
back
for
the
that.
recording, I said, okay, aye, yeah.
We were waiting for that critical second vote.
Otherwise, it ended up in a tie.
That's it.
All right, under Human Resources, consider approval of administrative services agreement with Navia Benefit Solutions in an amount of $125,000 to provide third-party administrative service for certain employee benefit plans that are maintained by the county through December 31st, 2026. Michelle, welcome.
Good morning, Commissioners.
Okay.
Michelle Shelton, Human Resources.
I'm Kathy Carter, Human Resources.
And we are here today to seek your approval for a contract with Navia Benefit Solutions to take over our current flexible spending account and health savings account and COBRA administration. This is a 4-year contract. The new vendor will allow us to streamline for efficiencies with both human resources and payroll. It will also greatly enhance the end-user experience, allowing HSA members to direct their investment options, which we don't have today. It also saves the county approximately $4,500 annually, and this contract would be effective 1/1/2022 for 4 years. Are there any questions we can answer for you?
I do not have any questions.
I just want to point out, the contract goes through 2024, but doesn't
It's
expire.
2026, isn't it?
2026, 5-year, but it says also for finance, technically, it doesn't expire. HR will review in 5 years. Is that accurate?
Yes, that's true.
Yes.
Okay.
But to extend it.
We would
over
have to,
100
come to board
You'd have
session
to
to
come to board
extend it,
session.
I understand.
Yep, got it. Okay. Well, we know that we need some help in this area. We've heard a few situations that we need to take care of, so I'm looking forward to seeing if these people are, as good as we think they are, and that's be a good positive thing for us. All right.
Okay, Mr. Chair, I move that we approve the administrative services agreement with Navia Benefit Solutions in the amount of $125,000 to provide third-party administrative services for certain employee benefit plans that are maintained by the county through December 31st, 2026.
I'll second the motion. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Okay.
Thank you, Michelle.
Thank you for bringing this forward. Appreciate it. All right, we don't have a public hearing today. I saw Brandon and Lindsay in here, and I'm going, I go, did I miss something? He must have been here for
We were just-
the presentation on the housing,
Oh, that could be.
I think.
That could be. All right,
Yeah.
you want me to read this calendar?
Sure. Well, you did it last week, didn't
I
you?
did do last week. Oh, if you want to take turns, all right.
I'll do it. I'll take my turn. I don't know, I kind of liked it to have the third vice chair, or second vice chair always read it. That was my plan. but
Yeah, I know.
It kind of got disrupted. All right, so our next item today is 115 Board of Commissioners Chief Administrative Office meeting, executive session if needed, in the Commissioners Boardroom on the 5th floor here in this building. Also today at 4 p.m., a FEMA briefing for local officials virtually, Commissioners Boardroom here on the 5th floor. Tomorrow, Thursday, the 23rd, 9 a.m., a work session on economic development update in the Commissioners Boardroom here on the 5th floor. Tomorrow at 11:45 a.m., Liberty House Champions Children for Luncheon at the Salem Convention Center, 200 Commercial Street Southeast. Monday, the 27th at noon, IT Director interviews in the Commissioners Boardroom here on the 5th floor. Tuesday, the 28th at 8 a.m., Community Corrections Board meeting here in this building in the Commissioners Boardroom. Tuesday, the 28th at 9:30, Management Update here in the Commissioners Boardroom. Tuesday, the 28th at 1:30, MCRI Community Collaborative Meeting, Union Gospel Mission at 777 Commercial Street Northeast. Tuesday, the 28th at 3 p.m., Marion County Housing Authority meeting, Board of Commissioners room here in the 5th floor. And Wednesday, the 29th, we're back here for board session at 9 a.m., and Wednesday, the 29th at noon, Catholic Community Services luncheon at Salem Convention Center, 200 Commercial Street. And Wednesday, the 29th at 1:15, Board of Commissioners, Chief Administrative Officer, executive session if needed here in the Commissioners Boardroom on the 5th floor. And Wednesday, the 29th at 2:30, Health and Human Services Policy meeting here in this building on the 5th floor. Still busy.
It's not slowing down.
Hey, there's a little game this weekend.
Is there?
Yeah.
Who's playing?
Does it involve ducks and beavers?
Well, it involves the beavers. Who cares about the ducks? I do care about the ducks. I have to be careful, but, yeah, no, it involves the beavers and your son's school down there. Yeah, and Vicky's, Vicky's school, and I was reading an article. They hadn't won, the Beavers have not won in the Coliseum since 1960.
Whoa. This is the weekend.
Uh-huh,
This
and
is it.
I was on the phone with Vicky this morning, and it's a 7:30 game, and I'm gonna go down for it, actually.
Oh, yeah?
Yeah, it's gonna be
Wearing
fun.
orange, bright orange.
You might see my son, he has tickets.
Okay, well, you
Orange
should
and
give him
black.
my cell number, and he can text me.
Wrap yourself in that Beaver flag.
Well, anyways, it's supposed to be hot, and the game's not set till 7:30, and I go, oh, it's a 7:30 game, but at least it'll be cooler. And she said, well, yeah, but when it's, 90 to 24 USC's ahead, we'll just leave early. And I'm like, no, this is gonna be a good game this year. I think it'll be really interesting. I don't think it'll be a blowout. I think it'll be a close game, so I'm excited about that. This is the first Beaver game I've gone to in, 3 years or so. Yeah.
Well, here's to hoping.
Here's to hoping.
This is the weekend.
This is hope, right?
This
We
is
have
it.
this is a month of hope.
That's it. You're gonna break the curse.
Yeah.
The curse of USC.
Yep. I don't know, who are the Ducks playing? Anybody know?
Well, I'm a really big football fan.
Yeah, I know you are. I know you are. All right, anything else?
Well, I'm excited to have Commissioner Bethel get back in
Back in the saddle?
back on the team and just move forward.
Looks like they're playing Arizona.
Oh, they are at home, or?
I don't know.
We had a board session, we just made a decision yesterday, we had a board session scheduled at Chemeketa, or a town hall scheduled at
right,
Chemeketa in
offsite.
October.
Yeah.
Just with everything that's going on with COVID, we decided yesterday to keep that here. I think that's just waiting till the next year, I think, before we can start getting back out on the road. But it's good to see people getting out. Just still need to be careful with what we're doing, so. All right. Anything else, Commissioner?
No, sir.
Legal counsel? Brenda? Really? You're so quiet today. All right, we will adjourn.